There are different kind of spinal injections. Usually these injection specifically targets a specific anatomical area in the spine. The focus of the treatment is usually try to treat the pain or specific abnormality that the patient has. Probably the most straightforward part of this procedure, part of this process is when we evaluate the imaging and we can see whether the patient, for example, has degenerative disc disease or they have the arthritis of the joints in the posterior aspect of the spine called facet joints. What sometimes is not very straightforward is actually the diagnosis of pain generator. Sometimes it's very difficult because there is not a one-to-one correlation between all the specific abnormalities observed on the image with the actual clinical presentation patient has. I believe that this is probably the most challenging part of overall evaluation of the patient. And sometimes we have to use diagnostic injections to actually establish cause and effect. But in general, once we establish the diagnosis and we have a treatment plan, then with these spinal injections, we'll focus on that specific structure. For example, a lot of times if patients have axial back pain, the pain generator is probably their facet joints. These joints are small joints on the back of their spine that can be irritated with a variety of activities such as extension or twisting. Then our treatment will focus on either injecting inside these joints or trying to block the nerves that innervates the facet joints and considering radiofrequency ablation. However, some other times, if the problem is due to disc herniation or degenerative disc disease, then a different kind of injection can be considered, which usually is epidural steroid injections.